My name is Sonia Vitalden. I'm one of the midwives here at Minnesota Community Care. I also have the pleasure of being the lead midwife and overseeing the group of midwives who practice here. I wanted to become a midwife because I felt like being a midwife brought together things that I love to do. I love to do things with my hands, and I wanted a job that was hands-on. I wanted to do something that was real and grounded in the community, and what midwives do, sitting and standing and walking with during birth, is about as real as life gets. I wanted to be a part of that. And I also had worked for a number of years with homeless families and had seen what an amazing time pregnancy and birth was in women's lives. And I said, that's what I want to do. I want to walk with women during that time and see their power and lift it up and meet them there with my hands.
Hi, I'm Lisa Smith. I am a nurse midwife here at La Clinica, and I've been a nurse midwife here since 1995. I speak English and Spanish, and I would love to take care of you and your babies. I was very interested in taking care of children. I wanted to be a pediatrician, and I met some pediatricians, and then I wasn't sure if that's what I wanted to do. And then I met an OBGYN doctor who let me go along to some births, and I was really excited about it, and the rest is history. My primary clinic is East Side Clinic and the east side of St. Paul, but I also have worked sometimes at La Clinica on Cesar Chavez and at Regents Hospital.
Hi, I'm Amy Hansen. I'm a midwife here at Minnesota Community Care, and I've been here for about 17 years. I became a midwife because while I spent some time as a missionary in West Africa, I got to attend my very first birth, and I fell in love with the process. I came to Minnesota Community Care because I see them serving people who are in need and overlooked, and I want to love on as many people as I can as a midwife.
My name is Patti Longard, and I have been a midwife for, I don't even know how long I've been a midwife, 15 years. I became a midwife after working in labor and delivery and recognizing that connecting with women about what they wanted in labor and birth had more to do with getting to know them during the pregnancy and walking with them through the whole experience rather than just meeting them on labor and delivery. And that's what started it, and I just kind of got slurped up into the whole world, and now I couldn't imagine being anything else. I am a lifer here at La Clinica. I'm not going anywhere. And I just really enjoy the women that we work with and the team that I get to work with.
Hi, I'm Tamara Jackman. I'm a midwife at MCC. I became interested in midwifery when I was a little girl, and my mom saw a midwife for her care when she was pregnant with my little sister. And as I got older, I was interested in studying the history of midwifery and women's health and natural processes like breastfeeding, and decided to pursue a career in midwifery. At MCC, we do a great job of supporting normal pregnancy and are also able to see women who have some more complicated pregnancies. There's a great team of midwives here. I've had the privilege to work here for 15 years and really enjoy the relationships I've developed with some patients and families that I've known for that whole time. So it's great to see people coming back over and over again, not just for their pregnancies, but then coming back for birth control and pap smears and other healthcare needs that they have.
My name is Diane Banigo, and I originally became a midwife because I was in awe of the miracle of birth. But after 17 years of practice, I have learned that midwifery means to be with women, and it's not limited to the bedside. And after acquiring my doctor's degree, I realized that the question should not be, why did I become a midwife, but the question should be, why am I still a midwife? And I've learned that to be with women can be in the form of social justice, policy, advocacy, and doing a lot of different things to help women be women in the space that they need to be in. And so that's why I continue to still practice a modified form of midwifery. The question is not, why did you become a midwife? I mean, a lot of times when we go into this field, we're still kids. or new. But when you live life, the reason that you stay invested in things change. And so you have to find something to keep you invested in the profession. Otherwise, you will leave it. And that's no fault to anyone that left, but you have to find a reason to stay vested. And so for me, that's advocacy, that's social justice, that's policy making, that's creative, being innovative, and breaking down the boundaries that women have been confined to traditionally, and especially in OB care.
My name is Elaine. I'm a midwife here, and I've been here for 11 and a half years. And what made me want to be a midwife? I wanted to work with women. I wanted to help women learn about themselves. I think women are awesome, and so I want to, just facilitate your awesomeness.
My name is Emily Rumsey, and I am one of the midwives here at Minnesota Community Care. I originally became interested in becoming a midwife for birth, but as time went on and I learned more about what being a midwife really was, I learned to love the full spectrum aspect of it. So taking care of people through their entire reproductive health years and beyond into menopause also. While I of course love attending births, and it is very special to watch your family grow and to be there to witness the birth of this new person, I really love the other stuff that we do in clinic just as much. The prenatal care for pregnant people, also helping prevent pregnancy. I have kind of a special love for birth control and helping you find the right method to help you control your family size, doing preventive care, reproductive health care, and all the different things that we get to do here at Minnesota Community Care.
Hi, I am Laura Leatherman-Clark. I am a nurse midwife with Minnesota Community Care. I decided to become a midwife when I was working at a sexual health clinic in college and realized the importance of working with people to have power and resources and to learn about their reproductive and sexual health. I came to Minnesota Community Care specifically because the midwives and the providers and all of the staff feel very strongly about the importance of the well-being and health of their patients and their community.
Hi, my name is Faiza Abdi Omar, and I've been a midwife with Minnesota Community Care for 9 months. My journey to midwifery started long before I knew I wanted to become a midwife. In nursing school, I got to assist in my first birth. After that experience, I knew I wanted to care for a woman during childbirth. 10 months into working as a new grad labor delivery nurse, I applied to midwifery school due to the lack of diversity and the significant ethnic and racial disparities persistent in women's health and health care. I wanted to represent the community we serve. What I like most about my job is that I get to connect with women and their families in a special way.
I'm Toni. I am a midwife at Minnesota Community Care. I first became a midwife because I was pretty intrigued with pregnancy and birth at a young age. I think that along with my own birth experiences, the experiences of my family and friends is what drew me to midwifery. I also have to believe that there's some ancestral ties because I feel like in a lot of ways midwifery chose me. I just think that it was a gift that was just kind of a seed that was planted in my heart and has just always been in my spirit to pursue.
My name's Mariella Rich. I'm a midwife here at Minnesota Community Care. I became a midwife and I am a midwife because I love working with people during these very important and significant events in their lives. I feel like it's such an honor to work with people during these times where they're making big decisions about their families and about their sexual and reproductive health.
Hi, I'm Kelsey Leonard-Smith, and most people call me Dr. Kelsey. I live here on the west side in St. Paul, and I love being outdoors in all weather with my family. I'm a family doctor on the perinatal team at Minnesota Community Care. I take care of all kinds of people, from newborns to kids to pregnant people and older folks. Sometimes other health concerns like diabetes or high blood pressure can make your pregnancy a little higher risk, and I collaborate with our midwives to keep you and your baby safe. I love caring for pregnant people and attending their births in the hospital.